I am so privileged to have connected with Stacy, and I am privileged to be connecting with you guys. One thing you're going to learn about me through this presentation, everyone is the expert on their own health. And right now, as we speak, there are over 32 million papers on PubMed. No doctor can know it all. No health professional can know it all. Went back in the day when there was one book about how to do medicine and you were like the local family pioneer doc, maybe you could know it all. Not the case anymore. We need all of us. And so I want this to be collaborative. And from the beginning, I'm going to let you know, like probably right now, there's a paper being presented that I wish I could have thrown in here. And so this will live on the site as a resource for you. But I'm here today for both you and your clients and I guess, and your loved ones. So integrative medicine and natural medicine can help everyone. And I'm going to teach you today, particularly how it relates to mental health, who you might see in your clinic that could use natural medicine to get them to the next level, and sort of the underlying biochemistry that we treat in natural medicine. And I want to let you know, if you don't have a pen and paper, maybe get one or get something to write with, because we're going to go really fast. There's 45 slides and I'm trying to get us done a little early to do Q&A. You're going to have questions, write them down. All of you can call me and do a free 15-minute consult. Your patients can call me and ask me your questions. If you don't get time today, let's connect afterwards. I want to make sure that they're answered. And then this is the website, and I'll send this out to you guys when this is done. So why should you listen to me? I feel like this is a good place to start. So I'm a naturopathic doctor, which means I'm trained in natural and preventive medicine in states like Washington, California, Oregon, Vermont, Arizona. We're primary care doctors. And we have training in nutrition, botanical medicine, homeopathy, counseling, and physical medicine, in addition to the pharmaceutical and minor surgery training that every primary care doctor gets. And so we're equipped with a really wide array of tools, and we're meant to fill that gap that exists right now between when you go to your primary and maybe you get really good care and labs and a prescription and a referral, and maybe you need surgery for your knee and you get that done. But then maybe you go back and you just say, I'm a little fatigued, or I'm just not myself, or I don't feel well. And they're like, "Well, your labs are normal and nothing's wrong." But then you leave and you're like, okay, nothing's wrong, but something's not right. That's when you come see a naturopathic doctor, because we're trained in what the body needs to work optimally. So we're the best people to see in that situation, which is the situation many of your clients are in. So this is personal for me. And so that's the other reason that I have developed a specialty in this. I was like many of your clients. So as a 17-year-old, I was in inpatient in Renfrew, IOP, really struggled with my mental health for 10 years, between 11 and 21, until I was diagnosed by a functional medicine doctor with celiac disease. And pretty much overnight, my body image issues, depression, insomnia resolved. And at that moment, I became addicted to learning about the root cause of mental health issues that we often don't see, that live in the body, that live in the environment, right? Because, and you guys know this, you're good at what you do. Many of your clients get better. Some of them struggle and you don't know why. And it's my job to figure out, is there something physiological that's holding them back? And it's surprising stuff that you would never expect. And I'm going to teach you some of it today. So we're going to talk about these three cases as we go through. And what I want you to remember, who needs this type of medicine? Someone who is not responding to treatment like you'd expect, right? We're going to start with one case study and we're going to follow these throughout the presentation. First is a young woman with anxiety. She's been to the ER a couple times, belly pain, panic attacks. They tell her nothing's wrong, patch her up, go home. This has happened 2 or 3 times in the last few months. She winds up in your office, of course, because she has anxiety. Second guy we're going to talk about has depression. It developed after a head injury, but never really went away. He's a weightlifter, does not like to cook. Third person, a woman in her midlife years who has had chronic PMDD, PMS, really difficult 2 weeks of every month for her, which you have given her skills to manage, but she's still, I just want to feel balanced. I don't want to feel this way. I don't want to have to work so hard every single week just to feel normal. So naturopathic medicine is the study of biochemistry and physiology and systems-based medicine. So I study the gut, right? And how does your gut actually extract nutrients from food that it needs to make neurotransmitters and keep inflammation low, right? I study the science of metabolism, and I look at the brain as the organ of behavior. When your brain doesn't work right, nothing works right. When your brain doesn't work right, you can't do CBT. Like you can, it's not going to work. You need a healthy brain to do your therapy best with. We're going to start with inflammation because that's where Stacey and I connected. And I do feel like this is an important concept to start with. So when we say inflammation, that word has started to feel like the word detox to me, which while it is a scientific term, has started to feel gimmicky, particularly in America. Like you're just like, what do you mean by that? Like inflammation is everywhere. You have inflammation in your joints. What exactly does that mean? There's three different types. So there's inappropriate immune activity, which is what happens in pandas and pans. We're going to talk about that in a second. There's arachidonic acid derived things like prostaglandins, leukotrienes, prostacyclin, chemicals that circulate in your blood and create havoc when they're not healing an acute injury. Inflammation is actually really helpful if you twist your ankle when you need that to heal, but chronically, not so good. And then the third type of inflammation is high levels of oxidative stress. And this is the most insidious. This is the most common. And I'm going to explain to you what this means because I honestly feel like until I got to med school, I didn't really get what oxidative stress was. Okay. So pandas, you've heard about it from Stacy. You're going to hear about it from me. What I want you to see is like these symptoms: separation anxiety, learning regression, handwriting disabilities, nighttime fears, bedwetting. These are not the only symptoms that can come with something like pandas, and you don't have to have all of them. So it could just be separation anxiety. And if you're not looking for these antibodies, you'll miss it. And so then you'll do therapy and you'll do all these different things, and it's not going to give them complete resolution. So it can be really mild and still have a component that is immune based. Pandas is a pediatric autoimmune neuropsychiatric disorder associated with strep. So if you have a client who has frequent strep throat or who has a history of frequent strep throat, this is the type of client that should be on your radar. Okay, maybe in order to get them to fully heal, yes, they do need really intensive therapy, but they also might need somebody to help them correct this underlying immune imbalance. And that's what people like me specialize in. So the other thing that you should know about is autoimmune encephalitis, because they are two sides of the same coin. Autoimmune encephalitis is a fancy word that basically means inflammation of the brain due to some autoimmune disorder. So that could be Hashimoto's, it could be celiac disease, it could be RA, lupus, you pick your disorder. It could be a chronic viral infection. It could be in response to another type of infection. And by the way, let's zoom out for a second. The reason that chronic viral infections are so often associated with autoimmune like activity is because viruses work by taking over your cells. They invade your cells. They use your cellular machinery to replicate. And so they trick your immune system into thinking they're you. And then that can go really wrong, right? Which is why chronic viral infections are sort of a risk factor for chronic inflammation. I want you to see these diagnostic criteria for possible autoimmune encephalitis. Now, all of these papers are written for medical doctors and medical professionals. Keep that in mind. The symptoms I am supposed to look for: working memory deficits, altered mental status, psychiatric symptoms. Top three. Who's going to see those first? You guys. They're going to come to you first. You think they're going to go to a doctor for that? No, they're coming to you. And then these are all things you have to do studies to find. And the third is exclude other alternative causes, which is the doctor's job. But these are going to present to therapists first. And this is why you guys have to be on the lookout for these disorders and send to somebody who can evaluate them and do the rest of the workup. People who are at risk, I already said, strep, autoimmune, viral infection, Lyme. Don't forget about it. Always ask your clients, do you have a history of Lyme? Worth knowing. Okay, we're going to talk about the second type. Arachidonic acid derived prostaglandins. This AA is arachidonic acid. It comes from mostly meat products. Now, is this a bad thing? No. But too much of it without accompanying omega-3s is not a great thing. It leads to too many of these leukotrienes, thromboxanes, prostacyclins, prostaglandins. It makes blood sticky. It creates overall inflammation in the bloodstream, which is not good when your blood is trying to get oxygen and nutrients to places far away from your heart and against gravity, like your brain. We'll talk about this again when we talk about nutrition, but this is another type of inflammation that is more diet-based and lifestyle-based and is very common. The last one's high oxidative stress. This paper I can send to you guys separately. Like this is, if you needed one picture of the physical component of depression, anxiety, and suicidality, this is it. It's complicated, but this is it. So we have, and I want you to see right here in the middle is oxidative stress. So here's stress, psychological stress, physiological stress, translates to oxidative stress. Then we have all of these things go wrong at a cellular level, and that leads to depression, PTSD, suicidal ideation. We can actually tell how severe somebody's depression is. We don't even have to talk to them. We just take their blood. That's pretty phenomenal. So the other thing I want you to see, we can, again, like when I say take their blood and look, what am I talking about? I have another slide that's going to completely overwhelm you, but you Google us, like you go to PubMed and you look for a study and you're going to find about 200,000 at this point. This one is just a one on bipolar depression and depression with F2 isoprosteins as the marker. This is probably like half of the more full list of things that you could check in the blood to tell how depressed someone is likely to be. What I want you to zoom in on is this TAC. This TAC stands for total antioxidant capacity. So let's read this. Lower TAC was noted in acute episodes of depressed patients, right? And we're going to talk about this for a second. So antioxidants, what are they? What do they do? This is so critically important. Okay. So out in the world, oxidative stress all the time. It's called rust. So you look at a piece of metal, basically reactive oxygen species have stolen electrons from that metal and it turns orange and rusts. That happens inside our bodies to our cells. It's not rust because we're not made of metal, but the equivalent is oxidative stress. Plants evolved in the outdoors, and so they have their own antioxidants to protect them from the oxidative stress of the external environment. This is why plant foods are so high in antioxidants. When we're talking about antioxidants, really mostly what we're talking about are vitamins. Vitamin C and E are two of the most powerful antioxidants. And then there's an amino acid derivative, glutathione, that we're going to talk about. But these come from the diet. You can't breathe them in. You really can't drink them. You got to eat plant foods or you're not going to get them. So we can do supplements too. So we're going to take B6, vitamin B as an example, and we're going to talk about this. I want you to notice B and C. The reason the antioxidants are so cool is not just because they keep a lid on inflammation, but because they do hundreds of other things in the body. So when we talk about health, what we're really talking about is biochemistry. And our biochemistry is run using vitamins, minerals, and amino acids and like some fats. And that's it. That's how we run every single reaction in our body. So yes, vitamin C is going to help us keep a lid on inflammation. But at the same time, it also helps turn dopamine into adrenaline, which is what we use to treat ADD, right? When we're giving Adderall, we're just giving fake adrenaline. If you don't have enough vitamin C, not only are you going to have chronic inflammation, but you'll have a hard time concentrating. We'll talk about tyrosine in a minute. So if you're like me, when I started med school, I was like, yeah, this is interesting. Nutrition is cool. But how many people in the US are really deficient in these? Probably not many. We're a well-resourced country. We tend to be overweight. Like these are probably not very common. So what do you guys think? And it's a good time to unmute. What would you guess is the top nutrient deficiency in the US?
Vitamin D.
Very good guess. Top 3 for sure.
12.
Great guess. Top 10. Who's gonna get it?
Vitamin C.
B. C. Love it. Arguably C could be it, but we don't measure C correctly. So I'm gonna tell you, these are all amazing guesses. You're all like on point. Vitamin B6.
Ah,
And this is not some weird naturopathic thing. This is the CDC. They team up with the USDA, NIH, FDA every year, and they survey the US population. And they go, what are the most common nutrients? Because this is how they determine what they use to fortify our food. So it's bad business for the government to have a bunch of sick, nutrient deficient people. We can't pay taxes. We can't work. We can't serve in the army. So it's helpful if our food is replete with the nutrients we tend to underconsume. It's like packing a multivitamin sneakily. And usually they do it in bread or cereal because Americans tend to eat those. Brilliant strategy. Actually, this is why we have iodized salt in our stores, because our soils in the US are deficient in iodine. When you don't consume iodine, you can't make thyroid hormone. So all of your clients who are super healthy doing sea salt that doesn't contain iodine, I hope they're eating seaweed and fish, or they're going to get hypothyroidism in 10 years, potentially. Have them call me. But B6, fascinating, right? Let's talk about that for a second. First of all, by say I, whose doctor has ever tested them for B6? Okay. Silence.
not that I know.
They haven't, because, and this information, even I was a naturopathic doctor. I didn't learn this, I think, until I graduated. This information somehow, even though our tax dollars paid for it, and even though we are, you would think doctors would be taught this, there's a gap right now in education between what are true deficiencies and what we're actually treating. And part of it is because you cannot patent a vitamin or a mineral. You cannot patent a naturally occurring substance. And so it's very difficult for a company to make money off of these. And so you don't have a high paid pharmaceutical rep coming in, giving free samples. You don't have people sponsoring talks at continuing education conferences. And so this information gets left out, even though it's critical. So notice what's circled. Signs of a B6 deficiency, irritability. Okay. How many of your clients are irritable? 25%? 50, 100%?
100.
The older they get, right, the higher the percentage. Confusion and depression. Okay, I think 100%, maybe like 80% of your clients have depression. So how many of your clients are at risk for this? So 11% of the general population has an overt deficiency, which like isn't even a mild insufficiency. It's, oh, we can tell in their blood, but you can get symptoms before that. And so sure, let's say 20% are walking around with suboptimal B6. The percentage in your office is going to be higher because these people see, oh, I'm irritable, I'm depressed, and they don't think I'm going to go to my primary care and ask them to test my B6. They think I'm going to go to a therapist, works for my friend. So many of your clients have this as part of their picture and don't even know. Top food sources of B6, and this is from ODS, Office of Dietary Supplements. It's run through the NIH. Your tax dollars pay for it. Please use it. I can give you the link. Top food sources, chickpeas, beef liver. When's the last time any of your clients ate beef liver? If they're under the age of 70, probably not recently. Tuna and salmon. Depressed people often do not like to cook. And so many of these medicinal meat foods they're not consuming. And additionally, your need for B6 can go up depending on the medicines you're taking. And if you are in the reproductive years of your life, you need B6 to metabolize estrogen. And so your need goes up. This is why the need in pregnancy and as females get older goes up. But it's not just what you intake, it's also what you absorb, which we'll talk about in a minute. Okay, iron, 10%. Let's go back. Common deficiencies. 10% of people are iron deficient. Somebody guessed that, I think. You were right. It's number 2. Okay, so let's talk about the clinical manifestations of an iron deficiency. We all know anemia is going to make you tired, but did you also know it can make you crave ice? Gives you headaches, gives you restless legs, exercise intolerance. So that patient that you're like, you're not going to get better if you don't move. And they're like, I want to, but I can't. It makes me so tired. Think about this. They should go to their primary and get a test. Okay. Do you guys think overweight or even obese people can have nutrient deficiencies? Yes. Okay. We all say yes when somebody asks us that. But I think in the back of our mind, it's not on the top of our list when somebody comes in and they look like they're normal weight or above. So what's cool is we've done studies of people before they go in for bariatric surgery, because you guys all know if somebody gets a gastric bypass, they're so far at risk for nutrient deficiencies. It's really crazy. But even before they go in, they often have nutrient deficiencies. Vitamin D in particular, ascorbic acid is vitamin C. And then if you look over here, iron deficiency is also an issue, right? So don't assume that just because somebody looks like they're eating enough, that they're eating the right things or even absorbing it. So there's 3 ways to determine risk. What goes in? You should measure what goes in. Do you guys have a nutritionist? Hi. Send everyone to her, please. Or me. Like you have to measure what they're getting in their food. And there's a right way and a wrong way to do that. Also, 2, what gets absorbed and what goes out. So somebody with really heavy periods can be eating an okay amount of iron, but their need for iron is elevated compared to a peer who is not menstruating or not bleeding heavily or often. Then there's functional lab testing. There's a right and a wrong way to measure labs. Measuring a serum level of a B vitamin is worthless. They're water soluble. It's not a good idea. You need somebody who actually knows how to check for these nutrients. Typical diet of someone who comes in to see me, this is actually quite a very healthy person who comes to see me. Most times these nutrients are in the yellow. So I do a really extensive nutrition analysis, 80 different data points when somebody comes in. And I use this, we usually start here after their brain take, and I'll show them like, hey, here's what you're getting. You get 5% of your vitamin D for the last 30 years. Do you expect that you don't have a vitamin D deficiency? And they're like, oh, my doctor told me to take vitamin D and I just forgot. This helps create awareness of where the gaps could be and why they might not feel good. Look at the B vitamins and like the minerals. No surprise that a person like this, even though they're eating a healthy diet, this was probably like Whole30. They're not feeling well. Okay. In terms of malabsorbing, right? Let's talk about celiac for a second. It's close to my heart. Celiac disease, I want you to zoom in on this. It's associated with attention deficit disorder, depression, chronic fatigue, joint pain, anemia, migraines, infertility, failure to thrive, delayed puberty, tooth problems, right? ADD and depression are going to walk in your office before they walk into the primary care. So keep your eyes out. And what I want you to see is that celiac disease, read this part. Classic celiac disease, characterized by mild to severe gastrointestinal symptoms, is less common than non-classic celiac disease, which is characterized by the absence of gastrointestinal symptoms. So it's more likely that somebody's going to come into your office with depression and ADD and have celiac than it is someone will come in with IBS and have celiac. Did that make sense? That was mind blowing to me when I learned it. It should be mind blowing to you guys because that's not what we're told, particularly in the media. The other thing is you can be on a gluten-free diet and still be completely nutrient deficient. Most gluten-free diets are really low in things like iron and calcium and vitamin D. So cool, your patient like removes gluten. That's maybe a third of the battle. Now we have to replete them of all the nutrients they're low in and make sure that their gluten-free diet is actually healthy. You'd be also shocked at like the number of things that gluten is in. Okay, just a plug for good testing. There's a thing called methylmalonic acid, which is actually how you measure a B12 deficiency. You don't check serum B12, you check methylmalonic acid. If you have questions, or your doctor checked your serum B12, call me. We'll go through it. Okay. So 3 cases, right? First lady has anxiety. Remember, she was in the ER, belly pain, panic attacks. Nobody knew what was going on. We ordered her a food allergy test. Food allergies, not food sensitivities. They're different. We can talk about that a different day. Food allergies. Second guy, depression, weightlifter, doesn't like to cook, right? Had a brain injury. We ordered him a hair heavy metals test. Now, did I order a lot more for these people? Yes, but these will be important. Severe PMS, we started this person on P5P, which is pyridoxal 5-phosphate, which is a phosphorylated version of B6, the number 1 deficiency in the US, and magnesium. We also started treating their gut to modify their estrobolome because estrogen dominance is often at the root of PMS to PMDD. So what was it? This person had an egg allergy. Did you know that stomach pain and anxiety are symptoms of anaphylaxis? How many of you knew this? None. Okay. Because we all watch Grey's Anatomy, and when someone's having anaphylaxis, they're like, oh my God, you stab them with the EpiPen. It's very dramatic and makes for interesting TV. Unfortunately, mild anaphylaxis can go unchecked for years before it gets to the point where it's severe enough to require that sort of emergency care. And in the meantime, you just have like neurologic symptoms like anxiety, apprehension, sense of impending doom. How many of you have counseled a client like this? Maybe ask them what they ate before they came in your office that day. If it was an egg sandwich, you should be like, send them over to me. Okay. And again, you guys will have this list, but start to keep in mind panic attacks do not have to have a root just in a psychological dysfunction. It can be very physiological. And part of that is because part of an anaphylactic reaction is histamine release. Histamine makes things leaky and changes your ventilation threshold. It makes you more likely to hyperventilate. So when you're having an allergic reaction, you're more likely to have hyperventilate and get pushed into an anxiety attack. Our weightlifting guy who doesn't like to cook was eating tons of tuna fish because all you have to do is mix it up with mayo and you're good to go. He had high levels of mercury, which is like crazy. I didn't think that was very common. I honestly didn't think I would see this very often in my clinical career, and I do see it enough, particularly in people who have very severe mental health issues and they're cutting, they have suicidal ideation, and you're thinking, okay, they're not getting better. What else is going on? It's worth checking hair. I think it's $65. You can actually pick up high mercury in the hair. So again, these are, if they're not otherwise noted, these are from Up to Date, which is basically like Dr. Wikipedia. You have to pay for it. It's amazing. It should be free. But hallmark features: change in personality, anxiety, shyness, like pathologic shyness. What? Irritability, insomnia, memory loss, depression, fatigue. Okay. How many of these people do you see? Yes. Okay. This last lady, PMDD. So this is a study that studied magnesium and B6 interventions for people with severe PMS. You'll see that their scores went down before the intervention. Their PMS score was around 40. After the intervention, it went down by more than half. And they didn't even use the right dose of magnesium. They probably used about a quarter of the magnesium that they should have been. So you can imagine that these results may have been even more dramatic if they had used the right dose of magnesium. This is often a problem with natural medicine research. The people who are not experts in natural medicine or nutrition are doing research on it. And so they'll use like 200 milligrams of magnesium when they should have been using 6. And so then it looks like the effect is less significant than it actually is. And then hang on one second, guys. Just take a look while we're waiting for this next page to load of all of the other symptoms. Never mind. The other thing, so estrobolome, you heard me mention this crazy word that means like your estrogen dominance and why we treat the gut. So there are certain bugs in your gut. Let's back up for a second. You detox your estrogen every single day. There's estrogen in your bloodstream. It runs through your liver. Your liver will put it through phase 2 conjugation, bind it into bile, store it in your gallbladder. It's excreted into the digestive tract where it binds to fiber, moves out of the body as stool. Unless you have a really unhealthy microbiome. And some of those bugs will free up that estrogen and it will recirculate. It gets resorbed through your colonic membrane back into your bloodstream. And then you get a buildup of estrogen. And so you get estrogen dominant symptoms. This sounded woo to me when somebody first started talking to me about estrogen dominance and how it recirculates. I was like, really? And then I got into the physiology and the research and I was like, oh, this is truly a thing. So treating someone's gut can help to treat all of their gynecological issues and mood issues surrounding their period. So I often look at the gut in people who have PMS and PMDD. We're almost done. I don't know why this is so slow. So who benefits from functional medicine? I'm going to give you guys this list and I want you to print out or keep it somewhere. Any of these issues should be a red flag to you that this person has other root cause things going on that are not only inhibiting their recovery from their mental emotional issues that they're seeing you for, but are creating havoc in their bodies. Good tests to ask a doctor for, right? If you have a client who's struggling and they're not getting better, depending on the symptoms, they can bring this test list into their primary and ask them for these. The other thing they can do, always just have them call me. If you even suspect, I do free 15-minute consults, like they can call me for free. And I can even say, okay, you've had your thyroid tested 6 months ago and you have no symptoms of allergies. I don't know that you need total immunoglobulins. Ask your doc for these 3 things. Get back to me in a couple weeks. Which is often what I do with people because then we can really have evidence-based medicine after that. We know what's going on.